everybody, my name is Dr. Milana Sapozhnikov. I'm one of the new eye doctors joining Dr. Julia Gior's practice. I'm very excited to be joining the practice, and I'm very excited to meet you all. So I knew that I wanted to be a doctor from a very young age. My grandmother was a doctor in Ukraine, and from a very early age I knew I wanted to take care of patients. When I went to medical school, I was able to rotate through many different specialties, and I absolutely fell in love with ophthalmology. I love that in ophthalmology you can take care of patients for many years, follow their overall eye health, help improve their vision, and also you're able to use your hands in order to make big improvements in their vision. For example, if a person develops cataracts, you're able to use your hands in order to improve their vision and help them see very much better and improve their quality of life. So I love ophthalmology, and I love many different parts about it. I think one of the most rewarding parts about ophthalmology is being able to do cataract surgery for my patients. It's so incredible when a person comes in and they can't see because they have cloudy lenses in their eyes. You're able to do a quick surgery and help dramatically improve their vision and improve a patient's quality of life. I think that's so amazing. Yes, definitely. So one of my most favorite patient stories that I remember is a lady who came into my clinic. She didn't have a lot of access to healthcare, and she waited many years before seeing an eye doctor. And for years and years, her vision was getting worse in her right eye, and she thought she was going blind. She was very afraid. And so I did a full eye exam. I realized that there was nothing wrong in the retina, there was nothing wrong in the front part of the eye. Her main issue was that she had a very cloudy lens in her eye, a cloudy cataract. And so I remember doing the surgery for her, and I remember her smile right after the surgery was finished. She was so happy. She was so thankful. She realized that she wasn't blind anymore. And lots of hugs were shared, lots of tears were shared, and it was one of my most special moments. So I'm very thankful to be an ophthalmologist. I think it's one of the best professions. I think it's so wonderful to be able to take care of a patient over many years, try to diagnose any small signs of early diabetes, of high blood pressure in the eyes, to be able to do procedures in order to prevent visual decline. But I feel like the most rewarding thing is to be able to actually use your hands and fix a person's vision, either by doing refractive surgery to try to get them out of eyeglasses, or by doing cataract surgery in order to improve their vision. Yeah, so I think that at the core it's very important to remember that a patient isn't just a patient, he's a human being in front of you. And so you have to remember that, and whenever you treat your patients, talk to them, communicate with them, hear their concerns, and know that you're treating them kind of like you would like to be treated. My grandmother was a doctor in Ukraine, and I have the utmost respect for her. She was loved by her patients. And she always taught me that it's important to do whatever you can to make sure that a patient feels heard, feels understood, and that you do all that you can for them. So I think that the most important thing is screening. It's very easy to get caught up in the busyness of life, to get caught up in work. And so it's very important to go to eye doctors, to do good annual eye exams, to do proper follow-ups, to make sure that there's nothing lurking, to make sure that the eyes are nice and healthy.